As we continue our ongoing conversation about why we do what we do here at MTM Services. And today we have with us Dr. Valerie Westhead, Medical Operations and Senior National Counsel Consultant for MTM Services. Good morning, Valerie. How are you?
I'm good. Good morning, Thomas. How are you doing?
Well, I can't complain. Let's get right down to it. Who are you and what is your positioning statement?
I am a psychiatrist who is also board certified in addiction medicine. I have been working for the last 20 years as a medical director and chief medical officer. And I came to MTM Services about 6 or 7 years ago through a project through the National Council. As a part of that project, I made some significant changes at my organization through the guidance that I received from MTM. And since that time, I have been a medical consultant for MTM to help other organizations make meaningful, sustainable change so that their systems of care can actually meet the needs of the individuals they are serving.
What is one of the major problems your clients face and come to you for solutions?
Well, some of the major issues are that in my organization, and many of these organizations that we work with, they are the service provider for the safety net. These are individuals who have been denied services at every corner. They often come without hope. They often come thinking that nothing will actually happen and work for them. In part because they do not have the resources. Their life circumstances are such that social determinants are interfering with their ability to function, and they are feeling overwhelmed. And our approach is to try and tease out what are the issues that they need help with. Certainly with regards to mental health, they are often dealing with significant depression, bipolar disorder, and schizophrenia and those disorders. But more often than not, most of our individuals are what we refer to as being co-occurring or dual disordered. They have both substance abuse and chronic mental health issues. In addition, they have not been able to access primary care. So on all three fronts, they are struggling to just stabilize and move forward with their lives.
With that response, which is a great one, how do you work with clients to solve this problem, and what is your role in your process?
My role, first as a provider, is to tease out what are the critical things that need to happen first. Usually that involves finding a way if they need to be detoxified from certain substances, if their mental illness is leading to potential dangerousness with regards to harming themselves or harming someone else. So we kind of do, in primary care, they refer to the ABCs, airway, breathing, and circulation. In behavioral health, we really look at what are the risk factors for self-preservation, and then where do we start with the most significant problems to help their lives to stabilize. And sometimes that is issues that we need to turn to the community for, the social determinants. Meeting the client where they are, identifying what is most important to them in this moment, guiding them to the things that I believe are most important to them in this moment, and then integrating them into our system of care. And over the years, my goal has been to create a system of care that allows that. And through my work with MTM, I work with organizations to try and help them identify the processes that they already have that can be tweaked and improved, and what processes should they consider adding to their system of care so that they can meet the needs, again, of the individuals we are all here to serve.
Now, what is the impact or outcome of your work with clients? What change do they see, and how does it impact the people that they serve?
Well, with regards to the individuals that I treat directly, we can monitor, are their lives stabilizing? Are they meeting some of those measures that we know exist? Are they keeping their follow-up appointments? Is their life become more stable? Are they engaging back with their families? Are their families understanding how to support them in their current process and condition? In my work with clients through MTM, I help them to identify how do they want to measure success? How do they integrate their team so that they're really focused on team-based care? This is not about silos, which is often what exists in organizations. This is about creating medical and clinical and business practices working together so that how the system is set up is actually delivering that value-based care that in the next coming years, we are all going to be held accountable to. And I think rightly so. I think our creating systems of care that actually address the substance abuse, mental health, primary care issues is something that we are called to do and that we can uniquely do. And the outcomes will be very clear. Improved performance with regards to HEDIS measures, as well as physical and psychological outcomes, blood pressure control, diabetes control, something that most individuals can understand, but also management of mood instability, also building resilience and helping individuals to actually find a way to cope with their life, re-engage with positive support systems, and then be able to build the life that they want for themselves.
That's what it's all about. Now, my final question, which you basically have already answered, and it's why you do what you do.
I came to behavioral health long ago in medical school, realizing that was a place where I could truly make a difference and where I could engage with people far more one-on-one and come to identify what is going on in their lives. Over the years and working in community behavioral health, I have come to be a systems thinker and trying to understand how can the system work for all of the people that we see, not just the individuals that I've been working with. And I believe that through MTM, I can take some of those skills that I have learned over many, many years and help other organizations to reach that same place.
That's outstanding. Dr. Valerie Westhead, Medical Operations and Senior National Counsel Consultant for MTM Services. This is why we do what we do. Thank you so much, Dr. Westhead.
Thank you, Thomas.